from taboo to tragedy. The real cost of ignoring menstrual health. Here we will discuss how neglecting menstrual health has affects women worldwide. The lack of access to safe and affordable menstrual products has led to unhygienic and uncomfortable periods, causing girls to miss school and women to miss work. The stigma surrounding the challenge has led to exclusion from social activities and opportunities. Neglecting menstrual health can also lead to health complications, including infections and complications during pregnancy and childbirth. The lack of comprehensive education seldom leads to confusion and fear, resulting in girls missing school and falling behind in their studies. Finally, the lack of policies and funding for this health cause has led to a lack of research programs to support menstruating individuals. Overall, the neglect of menstrual health is a serious issue that needs to be addressed, as it has far-reaching consequences for the health, education, and social status of women worldwide. Period health is a crucial issue that affects the physical, emotional, and social well-being of women and girls worldwide. According to the World Health Organization, approximately 2 billion women worldwide are of reproductive age, and nearly half of them experience menstrual bleeding. However, despite its prevalence, it remains a neglected health issue, particularly in low-income countries. One of the most significant failures in addressing the health concern is the lack of access to menstrual products. According to UNICEF, 1 in 3 girls in South Asia misses school during their periods due to a lack of access to sanitary products. In sub-Saharan Africa, the figure is 1 in 10. Additionally, a study by WaterAid found that in rural areas of Ghana, only 16% of girls had access to menstrual products. Another significant failure is the lack of proper intimate health education. UNESCO reports that menstrual education is often inadequate or absent in many countries, leading to myths and stigma surrounding periods. This lack of knowledge can result in unhygienic practices, social exclusion, and even mental health problems. The silence and shame surrounding period health also lead to a lack of research and inadequate policy support. According to a 2018 study published in The Lancet, a paltry 1.6% of global public health funding is allocated to menstrual health research, despite its significant impact on women's lives. Addressing these failures, several solutions can be put in place. Providing access to period hygiene products, such as subsidizing their cost or providing them for free, can significantly improve women's lives. For example, a pilot program in Kenya found that providing free menstrual products increased girls' school attendance by 30%. Comprehensive menstrual education programs, including menstrual hygiene management, can dispel myths and reduce stigma, leading to improved mental health and confidence. Additionally, investing in menstrual health research can lead to the development of better diagnostic tools and treatments for period-related health conditions. By recognizing and addressing women's intimate health as a crucial aspect of women's health and well-being, we can work towards a world where every woman can manage her menstrual health with dignity and respect. One of the biggest failures in period health is the lack of education about the menstrual cycle, though ingenious innovation today provides for such gadgets that monitor this. A link to them can be found in link below this video. According to a survey by Plan International, 48% of girls in Iran, 10% of girls in India, and 14% of girls in Indonesia believed that menstruation was a disease. This lack of understanding leads to a variety of problems, including confusion, shame, and stigma surrounding the health challenge. UNESCO estimates that 1 in 10 girls in sub-Saharan Africa misses school during menstruation, while a survey in Nepal found that girls missed up to 5 days of school per month due to parietal-related issues. Lack of menstrual education can also lead to health problems, as girls may not know how to manage their periods safely and hygienically. It is clear that menstrual education is essential for girls' health, education, and empowerment, yet many still lack access to it. Access to period hygiene products is a crucial issue affecting the lives of millions of women around the world. According to the United Nations, around 500 million women globally lack access to adequate sanitation facilities during menstruation, and more than 2 billion women do not have access to basic menstrual products. In some countries, their cost of products is so high that women have to choose between buying them or other basic necessities. In India, for example, only 12% of women can afford to buy sanitary pads. This lack of access to basic menstrual products often leads to unhygienic practices, such as resorting to old rags, newspapers, or leaves, which can cause infections and other health problems. Moreover, according to a study by the World Health Organization, girls who lack access to period hygiene products are more likely to miss school during their periods, which can have a significant impact on their education. In some parts of the world, girls miss up to 20% of school days due to the challenge. In conclusion, the lack of access to basic menstrual products is a significant issue that needs to be addressed urgently. Governments, NGOs, and all players alike must work together to provide affordable and accessible menstrual products to women around the world, ensuring that they can maintain their health, dignity, and education. Menstrual pain and cramps affect a significant proportion of women worldwide and can significantly impact their daily lives. According to the American College of Obstetricians and Gynecologists, 20% of women experience painful periods, and up to 90% report some level of discomfort during the menstrual cycle. Additionally, period pain and cramps are one of the leading causes of missed work or school days among women. Despite the prevalence and impact of menstrual pain, many women are dismissed or told to deal with it, instead of receiving proper treatment and support. This dismissal is often rooted in cultural stigmas surrounding menstruation, which can lead to a lack of research funding, inadequate medical training, and limited access to resources for period pain management. For example, a study conducted in Nigeria found that 77% of women with menstrual pain did not seek medical care, largely due to lack of access or belief that their pain was normal. Similarly, a survey of women in the United Kingdom found that over a third had never discussed the painful challenge with a healthcare provider. Overall, it is clear that menstrual pain and cramps are a significant issue affecting the lives of countless women, and it is essential to prioritize research, education, and access to resources to ensure that women receive the support and treatment they need. Menstrual cups and reusable pads are sustainable and cost-effective alternatives to disposable products. According to a study by the University of Edinburgh, menstrual cups were found to be as effective as tampons, with women reporting high levels of satisfaction and comfort. In addition to being more eco-friendly, menstrual cups can save women up to $100 a year compared to disposable products. Reusable pads also offer a sustainable and cost-effective alternative. One reusable pad can last up to 5 years, eliminating the need for around 120 disposable pads per year. According to a study by the United Nations, 500 billion disposable menstrual products are discarded globally each year, contributing to environmental pollution. Fortunately, these products are becoming more popular and accessible. In Kenya, the Zan Africa Foundation distributes reusable pads to schoolgirls, enabling them to stay in school during their periods. In India, the government has launched a scheme to distribute free menstrual cups to women in rural areas. These examples demonstrate the potential for menstrual cups and reusable pads to provide sustainable and cost-effective solutions to period product waste and cost. Education and awareness campaigns have proven to be effective in reducing the stigma surrounding menstruation and empowering women to take control of their health. In India, where menstrual taboos are prevalent, the government launched the Menstrual Hygiene Scheme in 2011, which included education programs for girls in schools. As a result, the percentage of girls using sanitary napkins increased from 12% to 78% in just 5 years. In Kenya, a study showed that girls who received menstrual education were 30% more likely to attend school during menstruation. Additionally, a study in Nepal found that women who had received menstrual education were more likely to use sanitary pads and less likely to experience reproductive tract infections. These examples illustrate the positive impact of education and awareness campaigns on menstrual health and well-being. Menstruation is a natural process that affects half of the world's population. However, inadequate menstrual hygiene management can lead to a range of health and social problems. According to a study by UNICEF, 1 in 10 girls in sub-Saharan Africa miss school during menstruation, which amounts to approximately 20% of their school year. In India, approximately 23 million girls drop out of school each year due to menstruation-related issues. Poor menstrual hygiene also increases the risk of infections, such as bacterial vaginosis and urinary tract infections. In fact, a study found that women who reported infrequent washing during menstruation had a significantly higher risk of bacterial vaginosis than women who reported washing regularly. By addressing these failures in menstrual health, we can improve the lives of millions of women around the world and reduce the social and economic impact of poor menstrual hygiene.